So I'm Dr. Catherine Bergeret-Galley. I'm a French plastic surgeon lady living in France. I've been studying a little bit in the States. I'm traveling a lot. I've been always traveling because I love it. I love to meet plastic surgeons and other people. And I'm also traveling a lot to Middle East. I have a lot of patients to follow up in Middle East. And well, we have when we are open on the others, people are coming from everywhere. I also have people coming from Mexico, but most of them, of course, they are more on the French Mexican community coming back to France for the summer. So it's great to exchange. So if I would introduce myself, I would say I like the rules, I like the tradition, but I like to share and have good relationship with my patients and my friends and colleagues. So it's very important to dedicate to the specialty, and in the way that you create a lot of friendship, a lot of links, and people are coming to you and they say, but what would you do in this case, Catherine? And you can answer, and I do the same when I have something which is really, when I'm wondering about something, and do not hesitate to share my not my anxiety, but my everything I want to deal with, and when it comes to take strong decision, we need to communicate together. By the way, we have now a lot of ladies involved in the Plastic Surgery Society deciding groups, and we have, for example, another doctor, Dr. Lina Triana, who is the actual president of the ISAP, the International Society for Aesthetic Plastic Surgery, and she also really dedicates for patients around the world to give the best treatment. So you see, it's a fantastic goal we would like to achieve in between 2023, 2024, and maybe 2025. Just pushing women to take action and participate more, and finding some resolutions and help patients to be treated better, always better. We have always been treating patients nicely, but the problem is now we realize that sometimes there is new needs, and we also have to adapt to these needs. It doesn't mean that we will accept everything. It just means that we try to give the best treatment depending on the situation and on the clinical cases, if we can talk about clinical cases. How did we have the idea of creating SOFCEP? At that time, I was still a baby in plastic surgery, starting to grow anyway. And SOFCEP was created in 1987. And we took this decision because we really wanted to have some scientific society more committed to our plastic aesthetic specialty. I mean, we member of SOFCEP are all belonging, I would say all. We are all belonging to the SOFCEP, which is a Society of Plastic-reconstructive and Aesthetic Surgery, the French one. But we felt at a certain point that we needed to have our specific society to talk about plastic aesthetic surgery, non-by-force reconstructive, and we wanted to be able to, we had a lot of people in private sector, in private practice, and we wanted to be able to share our experience and be comfortable with it, and have also our own discussion on facelift, on eyelid surgery, on body reshaping. So you see, it was good to have our own scientific society. That was the main goal, because it's good to mix once a year for the annual meeting with all the friends who are more reconstructive. By the way, I'm still doing also as a president of the SOFCEP, I'm also doing, like many other former presidents, I'm also doing some reconstructive surgery. For example, breast reconstruction after cancer, mama cancer excision. But we really needed to have this moment of privilege with our own conference to be sharing this plastic aesthetic surgery. And we wanted also something very important to open on the international. We wanted to have guests from other society coming, and through all these years, because we started in 1987, with very good former president, and still active. Some of them are retired, and we really wanted to welcome some foreigners, some different plastic surgeons, international plastic surgeons, so they could join our meeting, and we could also push our member to go to their meeting. So it was really, it has always been this criteria of sharing, exchanging, and getting together. It's really important in SOFCEP. The president is not alone, which is good and not good sometimes, but we have a committee, so we have 14 members, we have a president, and we have 3 vice presidents. So we have the first one, the second one, and the third one. And we have a secretary, general secretary, we have a treasurer, and we have some helper for the treasurer, and also a helper for the general secretary. So we are not alone. We have 14 members, we take decisions, but the role of the president is crucial, because this is a short time period. It's only 1 year. So if we want to bring some input or bring something different to our group, we need to work hard politically, so we can get everybody to agree. Then maybe we need to change a little bit the strategy, or to make partnership with different societies, always trying to expand and have more people to know about SOFCEP, which is important. At that moment, I really want to expand our partnership with Central and South America. We already created a few years ago a permanent partnership with the ASAPS, which is the American Society of Aesthetic Plastic Surgery. And we also have a strong partnership with the ISAPS, which is the International Society for Aesthetic Plastic Surgery. But at a certain point, we had also contact with the HIPRAS when it was existing, so it was more on regenerative surgery. And now we have partnership with Italian Society, Belgian Society, Turkish Society. We still, even if it's no more formalized, we still partner with the British Society, the BAPS, the German. But you know, it's in every country there is sometimes 1, 2, sometimes 3 societies, maybe in Italia. So it's we try always to get the maximum of friendship and the maximum of exchange with other members. And now this year, this is my time, and I really want to dedicate to Central and South America. And we have a specific partnership with the Brazilian Society. There are 6,700 members. This is the biggest society in the world. And so we have a partnership with the global, the SVPC, the Plastic and Reconstructive Aesthetic Surgery Society of Brazil, and also the Argentinian Society, the Aesthetic Society of Argentina. So, and we will have also some guests of PILAPS, which is a confederation of Central and South America. So this is great. We are having more friends, sharing more things together, and trying to have evolution always on the spot, and trying to be always innovating. Updating is very important. It has always been the goal also of the scientific society. Even if we have in France, we are very lucky because we have also a third structure, which is our syndicate. And the syndicate is really dealing with deontology, ethics, and the way of behaving with good manners. But in scientific society, we always try to have a good ethic. It means knowing how we can treat better our patient, how we can do better for our patient, how we need to deal in between a patient and a plastic surgeon, some rules. But I would say that because we have this syndicate in France, this is more the role of the syndicate. the good ethics, the good practice, and good behavior and deontology, and also teaching ourselves, because we constantly learn, even if we are a senior plastic surgeon or you are a junior plastic surgeon, you need to learn more, of course, but it's important to share experience, how to deal with difficult patients. Sometimes patients are difficult because they are very ill. They might also have some psychological problems. It's also a form of illness, or they have some social difficulties. So we have to adapt to everything. So we try to really to give them the best treatment, adapted to their needs. But also we need respect for that. And we need also people to understand that we dedicate ourselves, but they have to follow up with a minimum of rules. I mean, post-operatively, of course, this is mandatory. As a SOFCEP goals, well, we will see more and more developing with international people, getting our young plastic surgeons to be more involved, because we have been facing a terrible situation with this COVID-19 pandemic, as every society, and as a group of 500 plastic aesthetic surgeons, we are like everybody. We are a group of people, and we had to face all the restriction, confinement with COVID, like freedom, lack of hope sometimes. It was quite difficult. And people now are becoming more individualist. I mean, it's difficult to have some young plastic surgeon to understand that more we are in a group, more powerful we are. And this is very important. That you are a human. I don't want to paraphrase Lévi-Strauss, because I will not remind it by heart. But the idea of Lévi-Strauss is really strong. I mean, you are only human because you need humans. And if you don't meet people, you just, well, you're losing the way. You don't realize it at the beginning, but you get more and more concentrated on yourself, and then you lose the contact with others, and you lose the need of sharing until a point then you've been excluding everybody from your life. So finally, when it's time, when you finally realize that you have to meet people, you have to talk about science with other doctors, other plastic surgeons, then sometimes it can be late, because you're no more after 10 years of not attending any scientific meeting, but you are reluctant and you don't know how to do. That's why we're also helping our young plastic surgeons to publish, but especially to communicate. Do a 10 minutes communications and in English, because even if we are very proud to be French, and the language talked in the world is definitely English, so we need to teach them and push them to communicate. Please come and participate, come and communicate in English. So it's great. It's a great exchange in between older and younger plastic surgeons in SOFCEP. We deal with the everything, the mind, the soul, the body, everything is connected.